Thanks for joining us today. Welcome to the Center for State's video series on the essential functions for monitoring, evaluating, and applying findings. This series is produced by the Capacity Building Center for States and funded by the Children's Bureau. The Monitoring, Evaluating, and Applying Findings brief is intended to help child welfare agency leaders, managers, and stakeholders take a structured approach to plan for and execute strategies to monitor and evaluate implementation efforts and interventions, strategies to collect and analyze data for a variety of evaluation types, and then using data to make decisions and plan for sustainability of programs where feasible. It does this by providing step-by-step guidance to strategize and develop a plan for evaluation, collect and analyze data and consider fidelity and costs, and then use results to make decisions about ongoing efforts and sustainability. The Monitoring, Evaluating, and Applying Findings brief is broken down into 4 parts and 11 essential functions or tasks. It is important to remember that while the steps are presented in a linear way, in practice, often these steps will overlap and be revisited as teams continue to monitor, evaluate, and apply their findings over time. Part 1 is setting the stage and includes considering the circumstances and needs of the agency, developing a logic model, identifying questions, and identifying the data measures, sources, and collection methods that will answer them, and then developing an evaluation plan. Part 2 is collect and analyze data, and it includes strategies to put the evaluation plan into place by collecting and analyzing the data outlined, and then 2 special featured topics that are a version of data collection and analysis. They are examining fidelity and analyzing costs. Part 3 outlines how to use the data collected to make decisions and adjustments, with 2 functions on sharing findings and recommendations, which is the topic of this module, and then making decisions to further spread, adjust, or discontinue. Then Part 4 is on sustainability planning and how teams should refine and implement a plan to sustain interventions when this is the decision of the team and stakeholder groups. Let's get started. Why do teams share findings and recommendations? To inform stakeholders about the progress of implementation and to keep them informed throughout the monitoring and evaluation process. To guide teams and stakeholders in making decisions about improvements in future implementation. To help support teams as they advocate for additional resources. And to continue to expand the knowledge base in child welfare about what works in what contexts. Teams should be sensitive, however, to potential concerns among some populations about sharing findings widely and should engage target populations in these decisions. Beyond funding agencies, teams should think about who else should know about the results, why, and what may help them understand and learn from the findings. Teams should discuss who they want to tell their story to and how they want to tell it. Teams should consider the different populations that may want to know beyond funders, for example, staff, system partners, youth and family advisory councils, target population members, etc. There may be several different forms in which the team can tell their intervention story, including written evaluation reports, articles, visual displays, briefings, or a combination of these. Regardless of the format and audience, teams should consider the following strategies when preparing to share the findings and recommendations. Summarize the evaluation design and findings simply and clearly. Know the audience and adapt the technical language as appropriate. Explain some considerations for interpreting the data. Reflect on how the findings support or counter the team's theory of change. Share insights from multiple stakeholder perspectives. What have other groups identified in the findings? Explain the implications for scaling up the intervention or replication of the intervention elsewhere. Include practical recommendations for next steps to make the intervention or implementation improvements and to strengthen ongoing data collection and analysis. Teams should consider key questions when sharing findings and recommendations. What key findings should be shared with stakeholders and in what format? Considering the information that may be important to each group can help teams decide the best way to present findings to that group. What key findings and lessons may be of interest to others working in child welfare, and how can they be shared? It is critical to continue to build the base of evidence in child welfare so that future efforts are informed about what works in what situations with which populations, and what it takes to achieve change. And what lessons can be learned? Teams should keep in mind that evaluation is part of a learning process. While it can be difficult to identify weaknesses or address potentially negative findings, for example, the failure to achieve expected outcomes, powerful lessons can emerge from honest reflection on findings and their implications for improvements. Let's take a look at an example that illustrates the presentation details that Washington County prepared to share the results of their formative evaluation on an in-home parenting program. The team prepared a report as well as an informational PowerPoint with an overview of their work on the intervention, including summaries and illustrations of the logic model, research questions, and evaluation design, as well as detailed data charts and narrative on the analyses and recommendations. The team shared results on component functioning. How did each component of the intervention work during evaluation? Reach. Did they reach the intended number of participants for the evaluation? Exposure. Were they meeting their targets on the amount of intervention content that participants received? Program fidelity. Was the program being delivered as it was intended? And proximal outcomes. Were their short-term outcomes on track? It sounds like the team is well prepared to share their findings, and they may continue to adapt this structure and the explanation of the findings for different target audiences to ensure that it meets the audience needs in a way that is meaningful to them. Let's take a moment to check in on what you've learned about sharing findings and recommendations. Why do teams share findings and recommendations? To inform stakeholders on the progress, guide teams in decision-making about the future of the intervention, support advocating for resources, and expand the knowledge base. How do teams share findings and recommendations? Teams share findings and recommendations by determining who to share their intervention story with and how to share to each stakeholder group. What can help teams share findings and recommendations? By considering as a team what findings to share and in what format to each stakeholder group, what lessons learned are important to others in child welfare, and what learning and improvements can come from negative findings. Now take this a step further by reviewing the reflection questions for share findings and recommendations in your monitoring, evaluating, and applying findings workbook to connect what you've learned to your own experience. Up next is make decisions to further spread, adjust, or discontinue the intervention, the 11th module in this series, and the second essential function in Part 3, using data to make decisions and adjustments.
This video was created by the Capacity Building Center for States, funded by the U.S. Department of Health and Human Services, Administration for Children and Families, Children's Bureau, under contract HHS P23320140033C. The content of this video does not necessarily reflect the official views of the Children's Bureau.